Imagine your dad living alone, barely getting out of bed. He complains of pain, and you discover bed sores. You Google it and buy supplies, doing your best to take care of him, but the sores just aren't going away. I'm your host, Valerie Borgman, and that really happened. When I met this family, they had no idea what home health was and that it could help their dad. This week, we're talking about the difference between in-home care and home health care. Welcome to Desperately Seeking Senior Living, a podcast for sons, daughters, grandkids, and spouses who suddenly find themselves tangled in the search for senior living and care. If you like today's episode, don't forget to subscribe and check out our doable download in today's show notes for a printable summary of the show and a bonus tip from our guest. You're listening to our doable tips, short answers to your questions. Don't see your question listed? Send us a note. Then don't forget to subscribe so you never miss an answer. Hi, and welcome to the show. This week, we're going to talk about two services that can really help seniors safely remain in their homes: in-home care, or also called personal care services, and home health care. These days, you can get just about any assistance you need right at home. So, where do your parents call home? Are they living in their actual house or a standalone retirement community? Because at either location, they might find that they want or need, or maybe you think they need, a little extra help in order to remain safe. So, let's start with in-home care. We did an episode a while back about in-home care, and I'll put a link to that episode in our doable download. In-home care services include the following: bathing, dressing, meal prep, laundry, house cleaning, yard work, shopping, money management, and really just about anything you can think of. We've had clients who were blind and hired someone to come in to read to them. Others have had the caregiver take care of their garden, actually doing gardening, and even playing cards. And also couples. We've worked with couples where one spouse has memory loss and just isn't safe to be home alone. So the wife hired in-home care to stay with her husband so she could have a much needed break. Now, the cost of these services vary across the US. We've seen hourly rates as low as $22 an hour, even $18 an hour, all the way up to $45 an hour. And many companies have a minimum number of hours per day in order to help manage staffing. We've seen these minimums be 2 hours, 4 hours, but you can also find companies that don't have any minimums and you can literally just hire someone for 1 hour a day. And these services are completely customizable, and they can even be provided 24 hours a day. Although I do have to say that at the 24 hours a day point, this is where families are really looking at the more affordable options of assisted living, memory care, or adult family homes. So let's talk about home health care. What is that, and what is the difference between home health care and in-home care? Well, it's actually pretty simple. Home health care is providing services for a medical need. So these can include things like wound care, like the bed sores that I mentioned, injections, infusion therapy, pain management, psychiatric services, nursing care, medication management, nutrition, social services, physical therapy, occupational therapy, and speech therapy. And probably the main benefit of having home health care is that, well, you're able to stay home as opposed to having to go to a skilled nursing facility, which is, if you listen to the episode that we had about nursing homes, it's just a more clinical setting. Definitely not as comfortable as home. Now, on a side note, there could be some limitations to home health care. We worked with a family that really wanted their mom to get stronger through daily physical therapy, so 5 days a week. And they were hoping this could be provided through home health care at home. But companies just were not able to staff 5 days. And generally, there's a maximum of what a doctor can order. Now, they could have gone through two different companies and paid privately, But when it comes to insurance, it actually made more sense for them to go ahead and have those services done in a skilled nursing environment. So it is possible that both of these services could be covered or partially covered by Medicare, but not every in home care company accepts Medicare. And there are certain qualifications that need to be met in order to make sure that your insurance will cover it. So you definitely want to check with your particular coverage. Both options do require an assessment to be done. And this assessment is usually done by the company. And then both of these options will also include a personalized care plan that is updated at every service, every time that a caregiver comes over. Now, with the home health option, that does have to be doctor ordered because you're talking about actual medical services. Okay, on another side note, if you missed our episode on the Caregiver app, check it out. And I'm going to put a link to that in show notes as well. These situations that we're talking about, where you have caregivers coming into the home and maybe you're providing some of the care as well, this is actually the perfect opportunity for a caregiving app. It actually makes it a seamless transfer of information from shift to shift and caregiver to caregiver. So you definitely want to check that out. These options, depending on the hours you need, it's very possible that, like I mentioned, you are going to be working with more than one caregiver. And let's be honest, when it comes to the in home care services, the non medical services like bathing and preparing meals, you might want to be providing some of these services yourself, either to save money or it's just part of what you feel like you want to do. A lot of times, though, this can be really taxing on families. I had a family once that we worked with where there were 5 siblings and they literally had a schedule and they were taking shifts. They were texting. They were doing all this texting back and forth of this is what's going on. And, this is how dad was today. And this is what we did. And it just became way too much for them. In their case, they needed some help. So whether you need that break with non-medical care or you need a medical service, it's possible to receive the care and stay home or stay in that retirement living community safely a little longer. Today's episode is brought to you by ClearPath Senior Living Solutions. ClearPath helps families find assisted living, memory care, and other resources. Find our contact information in today's show notes. Check out this episode's doable download in show notes for details, including industry terms and definitions we discussed, as well as a bonus tip from our guest. Have questions or your own tips to share? Leave us a message. We'd love to hear from you. And until next time, make it doable.